Good afternoon and welcome. Thank you for joining us as we celebrate the induction of two endowed chairs from Case Western Reserve University and the School of Medicine. The appointments of Dr. Marina Magrey as the Roland W. Moskowitz, MD, Professor of Rheumatic Diseases is the first. Marina is the Chief of Rheumatology at UH and is an expert in inflammatory arthritis, and in particular, spondyloarthritis. And our second is Dr. Loretta Szczotka-Flynn as the Philip F. and Elizabeth Searle Wang, MD, Professor of Ophthalmology. Loretta practices at UH as well, and she is the Chief of Contact Lens Science and Research Clinical Programs. And a special welcome to Loretta and Marina's families who are joining us this afternoon. Let me tell you a little bit about our professorship ceremonies. They are designed to honor our best and our brightest faculty, to thank them for their contributions to human health. There is fierce competition for top talent at any academic medical center, and our endowed professorships help attract and retain our best and our brightest physicians, scientists, and researchers. We have more than 120 endowed professorships at the School of Medicine. More than 2/3 of these were established during the recent Forward Thinking campaign. And they act as a testament to our valued efforts to employ, engage, and pursue the best scholarship that we can as an academic medical center on into the continuum of the future. We are greatly appreciative of the generous donors who have made these professorships possible, both now and in the future. So let me tell you a little bit about the origin of each of these professorships and the impact that they've had on our School of Medicine. I'd like to start with the Moskowitz Professorship. Dr. Roland Moskowitz, or Raleigh as those who knew him called him, was a giant in the field of rheumatologic disorders for decades here at UH, and one of the handful of researchers who doggedly rose to one of the rheumatologist's greatest challenges, and that is osteoarthritis. I'm honored to say that I've known Raleigh and knew him for the last 35 years of his life here at UH in his case. His legacy career in rheumatology is rooted in his excellence as a researcher, educator, inquisitor, and clinician, and as a man of incredible character. He's been honored both by Case and at UH in the past. His serious efforts to look at the science of rheumatologic disorders was complemented by his warmth and humor and his incredible smile. His style, demeanor, and enthusiasm were lifelong lessons from numerous students, colleagues, and leaders, all of whom he inspired. Dr. Moskowitz was a professor of medicine at the School of Medicine and former director and member of Rheumatology Clinical Research Unit and the Division of Rheumatologic Diseases in the Department of Medicine at University Hospitals, Cleveland Medical Center. He began his training in rheumatology and internal medicine at the Mayo Clinic. Soon after, Dr. Moskowitz joined the Faculty of Medicine at Temple and later Case Western Reserve University. He was a revered clinician and educator. His research focused on the pathophysiology and genetics of osteoarthritis. He developed a meniscectomy model, which became known as the Moskowitz Model, to understand degenerative arthritis of joints. In 1990, he received international recognition for research linking osteoarthritis to a defective collagen gene. While Raleigh and I shared patients, his humor and ability to pinpoint key clinical and institutional issues and his grace in the face of his own disease were telling of his character. We worked together for 2 decades on mesenchymal stem cells. And he was delighted to see many clinical trials take place in this disorder. And especially, he would be pleased now to know that we have a number of clinical trials ongoing in rheumatoid arthritis for mesenchymal stem cells. Dr. Moskowitz passed away in 2018. In 2000, a professorship was established in his honor by a number of his generous colleagues and friends. I'd now like to move on to the Searle Wang Professorship. Philip and Elizabeth Searle were ardent supporters of Dr. Sumer Wang's work, and they established a professorship to advance the department's efforts in ophthalmology. Philip Searle retired in 1986 after serving as the chair of Sun Banks, a Florida multi-bank holding company and the largest bank affiliate of Sun Trust Banks. He also served as chair and CEO of Flagship Banks of Miami and CEO of Bank Ohio Corporation in Columbus. He was a member of the Federal Advisory Council for the Board of Governors of the Federal Reserve System, which we hear about a lot in the news now, and served as chairman of the National Advisory Board for the Resolution Trust Corporation. His wife, Betty, took up bridge at a young age and became a life master in 1964. She went on to compete in national bridge tournaments at various highest levels. Philip passed away in 2007, and Elizabeth passed away in 2012. At Case Western Reserve, Dr. Suber Wang held the Philip and Elizabeth Searle Professorship and served as Vice Chair, Residency Program Director, and Director of the Center for Retina and Macular Diseases until 2014 here at Case Western and at UH. During that time, I came to know Suber very well as a tennis parent because we got to sit around and watch as our children competed with tennis competitions for 3 years during their high school period. His engaging style is disarming and is well recognized by all until he needs to make a point, which I view it as just another game of love in tennis, which means I would lose and he would win. His name was added to the professorship in his honor by the Searle family. Well, Dr. Wang remains active. He is CEO of the Retina Center of Ohio, an assistant clinical professor of ophthalmology at the Bascom Palmer Eye Institute at the University of Miami. He is also CEO of the Future Vision Foundation. His research and mission celebrates breathtaking vision research through powerful documentation of discovery, impact, and hope. He created the Future Vision Forum to bring visionary leaders of basic translational and clinical research in retina diseases together to seek new directions to accelerate discovery and innovation. It is now my pleasure to turn to the candidates for the chair appointment. Each has undergone a departmental nomination, review, and presentation to me in my role as dean. And I have then brought that review forward to the provost and the university president, where it was then presented to the board of Case Western Reserve University, and finally, the approval by that board. It is a process that ensures that we select the highest quality candidates with substantial accomplishments and national reputation. Congratulations to each of our professorship designees. To present Marina Magrey, it is my pleasure to introduce Dr. Robert Czolota. Dr. Czolota is a professor and chair of our Department of Medicine at Case and at UH, and is a member of the Population and Cancer Prevention Program of the Case Comprehensive Cancer Center. Previously, he was a chief of the Division of Infectious Disease and HIV Medicine for nearly 20 years at university hospitals. He is the founding director of the Infectious Diseases and Immunology Institute of the School of Medicine and of UH. In addition, he is the Horde Chair of Medicine at Case Western Reserve University and the Steris Chair of Excellence in Medicine at UH, and is a member of our Center for Global Health and Diseases. He has served on the UH board, an honor for any physician, and one that he has served UH exceptionally well. He has been an active principal investigator in HIV/AIDS-related research studies for the Uganda Case Western Reserve University Research Collaboration since 1997. His clinical interest and evaluation in management of infectious diseases of immunocompromised hosts and healthcare-associated infections has been a mainstay of his work. He's been very active in COVID research and COVID vaccine development, and COVID management at UH. His additional research interests in the epidemiology of infectious diseases, clinical trials, new therapeutics for emerging infections, and clinical HIV/AIDS research has related to antivirals as well as management of complications of infection in this population. I'm glad to say that he and I share a current large U54 grant from the NIH to study HIV and lung cancer in Tanzania and Uganda. Dr. Szczotka has been considered a consummate physician and clinical educator, has been recognized by the Department of Medicine with a Teacher of the Year Award, is a master clinician and educator for the Department of Medicine, and he was the inaugural recipient of the Master Clinician in Infectious Diseases at UH Cleveland Medical Center. He is internationally recognized as a researcher in clinical trials and received numerous funding from the NIH. I am delighted that he will now present our designee for the Moskowitz Professorship.
Thanks very much, Stan. And it's my pleasure to present Marina with this professorship on behalf of this Case Western Reserve University School of Medicine. Here you see that infectious smile of Raleigh Moskowitz as we knew him well. He was world-renowned in terms of his work, and Stan has gone over this in great detail. Wonderful family, and it's a pleasure to present this professorship to Marina Magrey. She is newly appointed as of last July as the division chief of rheumatology here at UH and at Case Western Reserve University. She came to us from Metro Health Medical Center, where she had a long career. We'll go over some of that in a few minutes. She graduated from the University of Kashmir in 1991. Importantly, she secured the first position, as they call it there in Kashmir, on parts 1 and 2 of the MD exams, and was voted the best outgoing graduate in her group. Those are her certificates there. Her early work involved activities in India and thereafter in the UK, and that was on the clinical level. She did her rheumatology, her residency in 1998 and her fellowship in 2008 at the Cleveland Clinic Foundation. Among other things, she received the Outstanding Research Award there. Thereafter, she had additional training through the years in management, clinical research, and epidemiology, and women in leadership positions as well. So she was very suited for assuming this position, and we were very lucky to attract her here. She initially had faculty positions at CCF and Metro Health Medical Center, and over the years, she rose through the ranks to be promoted to professor in 2020. One of her major mentors was Dr. Mahmood Khan at Metro Health Medical Center. He is internationally known for his work on ankylosing spondylitis and influenced Dr. Magrey in terms of the choice of this area for study for her research pursuits. He is not only a renowned physician researcher, but a patient with ankylosing spondylitis himself. With him, and she continues this, she established a unique database of over 300 patients with AS and studied many of the clinical conundrums that face these patients with this condition. Furthermore, she has research and clinical expertise, as we just mentioned, in the development of spondyloarthritis. She ran one of the special centers in North America and maintained this longitudinal registry for over 300 patients. She also served as PI for a prospective study of 100 patients with radiographic spondyloarthritis studying the role of DEXA scanning and detecting osteoporosis in these individuals, which was funded by the Arthritis Foundation. She also led a study on identifying plasma microRNA expression profile in AS, funded by the National Institutes of Health. She is a member of the Assessment of Spondyloarthritis International Society, ASAS, and the Spondyloarthritis Research and Treatment Network, Spartan. She is working on classification of axial spondyloarthritis sponsored by the Spartan Group. She also completed an international collaborative multi-center trial about peripheral involvement in spondyloarthritis, which has resulted in multiple publications. She was the PI representing North America and recruited over 100 patients into this study. And she's also collaborating with the study RAPROPR, which is a head-to-head real-world pragmatic study to evaluate the effectiveness of different therapies for rheumatoid arthritis. And this study is funded by PCORI. Further leveraging her experience, she serves on the board of the Spondyloarthritis Treatment and Research Network, which is a society of experts in this particular area in North America. She's doing collaborative projects, as mentioned, including the referral guidelines and working on referral guidelines for AS. She's on the American College of Rheumatology Guidelines Subcommittee and is an invited member of the Assessment of Spondyloarthritis International Society as well. So we talked about her collaborative work. More recently, she has, in the collaborative network, developed collaborations with the University of Utah and Pennsylvania. She's also collaborating and doing translational research related to increased atherogenesis in patients with AS. And we know that chronic inflammation in that regard can contribute to other conditions like coronary artery disease. She has started both investigator-initiated and industry-sponsored clinical trials, is actively involved in the growth of the division. She's revamping the clinical service and the fellowship program at university hospitals. And she also finds time to volunteer at the medical school for their admissions committee and the continuing medical education committee as well. She tells me that her life is also shaped by her family, very importantly, and her faith. Here, her son, Zaim, and her husband here, Masrur, are very proud of their son who is at the Lerner College of Medicine. And hopefully he's going to stay in internal medicine, among other things. And her other son, MR, is graduated from the Wharton Business School in 2021, currently working in New York City in the McKinsey and health management. So very spectacular children, obviously taking advantage of their fabulous parents and their upbringing to get to these levels. Lastly, she has also given back to the community and has started the Salam Clinic that offers primary and preventative care, and she's shown here in this picture. So dedication to community-based work, impoverished groups, and it's just phenomenal what she's done. And with that, I'd like to open this or offer this to Marina. Let me stop sharing my screen, and then we'll go from there. Thank you very much.
Thank you, Bob, for that such a great and generous introduction. I was asked to talk about my journey till now, and there was a lot I could have talked about, but in the interest of time, I'm going to highlight some important things that have happened over this course of my life till now. For those of you who don't know, I was born in Kashmir, which is the very northern area of that subcontinent up in the Himalayas. I grew up in a family of four, three girls and a boy. And my father, he was a role model to me ever since I was a little girl. My father, he didn't come from a very privileged background, but, worked very hard. And because of his perseverance, he topped the exams, both the high school and the college and entrance exams, and ended up being an engineer in public health and irrigation, and retired as the head of the Department of Public Health and Irrigation in the state. Growing up, I remember him telling me all the time that it's only 1% inspiration and 99% perspiration. And I followed that advice all my life. My mother, she was, I would say, a paragon of motherhood. She is an example of idealism and individualism. She never went to college, but she made sure that all her three daughters got the best education. So I I went to Government Medical College, Kashmir, University of Kashmir, and graduated in 1991. Things had taken a bad turn in Kashmir at that time, so me and my husband decided to go for further training to UK. So we were doing house job in UK, and we went there in 1993, and we were recruited by Cleveland Clinic, both of us, to come to Cleveland. And we landed in Cleveland in 1994, and ever since then have been here. And I did my internal medicine residency and graduated in 1998. I had given birth to two kids by then and as a resident. And I think motherhood took the precedence. As we all know, during this pandemic, a lot of scientist moms and clinician moms had to make choices when schools got closed and daycares got closed. And so I made a choice at that time that I wanted to take a job where we would have some fixed hours. There were no ACGME mandated hours at that time, and I was a resident. So I took a job at Metro Health and joined in the faculty of, medicine, Department of Medicine as an internal medicine attending. I worked there for a few years and then, decided to go back for my training. During my, career, I met many people, and some of them have been very kind, and some of them left a very indelible impression on my life. And few of them I call my mentors, and I'm going to talk about few of my mentors in the next two slides. My first mentor was Byron J. Hoover. He was an endocrinologist at the Cleveland Clinic. So Byron was he actually introduced me to research. Before that, I had never imagined I was going to do research. And my first research project was with him. It was a clinical project. We were looking at whether insulin therapy would help to lower triglycerides in patients in non-insulin dependent patients, without having the glycemic control. With insulin therapy impact the triglycerides without impacting the glycemic control. I was very excited about the project, and this was my first research project. Then during my fellowship, I met Dr. Gary Hoffman, who was the chief of rheumatology, the division chief at the Cleveland Clinic. And Gary actually was the person who made me realize that I need to learn to think outside of the box. I would often, approach him with many clinical conundrums in vasculitis, and he would encourage me to go and do research. And he had a database, and sometimes to find answers to those questions, I would use his database. And we together published a seminal paper showing that there was persistent hematuria after induction of remission in patients with granulomatosis with cholangitis. And this was the first time, we were able to show that in a scientific manner. My other mentor who I want to mention is Dr. Leonard Calabrese. Besides being a master clinician, Lenny is a very generous person. He has always been a persistent champion of me ever since I have met him. And if it was not his support, I would not have been here today. Now, I also have some female role models. One of the role models was Dr. Melinda Estes. She was a neuropathologist at the Cleveland Clinic, and she recruited us in London, me and my husband both, to come to Cleveland. And during my first few years in Cleveland, she actually was, her generosity, her kindness allowed us to settle in this new town and city where we had no family. My program director was Dr. Susan Ream, and she despite being on the board of governors, was very humble, and I learned a lot from her humility. And then Dr. Abelson, who was my program director when I was a rheumatology fellow, Abby has been my role model, both as a mother and as a leader. Then after I finished my fellowship in 2008, I went back to Cleveland Clinic to join the division of rheumatology there as a faculty. And that is where I gravitated, my interest, research interests gravitated towards axial spondyloarthritis or ankylosing spondyloarthritis, because there was a large and a unique population of these patients at Metro Health, and mainly because of Dr. Khan, who is not only a clinician and researcher, and as mentioned earlier, also has ankylosing spondylitis and had attracted patients from all over the country and world and had developed a large patient population. The two people that gave impetus to my research in axial spondyloarthritis are these two gentlemen here, Dr. Huckey, who introduced me to translational research, and I collaborated with his lab to study microRNAs as a biomarker for disease activity in ankylosing spondylitis. And Dr. Khan, who introduced me to clinical research, and with this large patient population, is that how I got interested in ankylosing spondylitis. In the next few slides, I will give a brief overview about my research expertise. I mainly focus about early diagnosis and treatment of axial spondyloarthritis. The reason for that is there is a diagnostic delay of about I would say estimated 6 to 10 years in this disease. And this delay is much longer in women than in men. And we still don't have any validated biomarkers for diagnosis or disease activity. Even though HLA-B27 molecule has been early on identified as a gene associated with the disease and also incriminated in the pathogenesis of the disease, but many patients, particularly minorities, African Americans, and women lack this gene. So that is where the problem comes, where we don't have any clear-cut biomarkers to make this diagnosis as we have in other diseases like rheumatoid arthritis or systemic lupus erythematosus. So one of my research interests is trying to identify and validating biomarkers of disease activity in axial spondyloarthritis, and that is where we did the study with the microRNAs. There are many gender and race-based differences in axial spondyloarthritis. Originally this was thought to be a disease of men, predominantly men and white men, but over time we have learned that this disease is equally common in women and also minorities. It's not as common as white men, but it is still common in minorities. But the problem is that women are a totally different phenotype than men. Women do not fuse their spine despite having an equivalent burden of pain, stiffness, and fatigue. And we still don't know some of these answers. And where is there my work is focused to find answers to these questions. The comorbidity burden is high in this disease, and I'm also looking into seeing how we can reduce this comorbidity burden in these patients. In the next few slides, I'll talk about some of the work that we recently did by collaborating with Dr. Ahmed Khalil at Case Western Reserve University. We tried to analyze the mRNAs in the IL-17 producing cells in axial SPA patients. We tried analyzing men and women, comparing them with the goal to identify certain genes that may tell us why this phenotypic difference between the two sexes. There were thousands of genes that were different between the two, and we found 15 important, significant pathways that are different between men and women with axial spondyloarthritis. Based on this data, what we found these S100 proteins, which are these cytosolic calcium binding proteins, were differentially expressed between men and women. So we tried measuring them into the plasma of patients with axial spondyloarthritis, particularly S104 protein, which is a negative regulator of bone formation. And we were able to find that the levels of S100A4 were significantly lower in male patients with more bone formation compared to female patients with no spinal involvement. This was a small exploratory study, and that is what I'm going to be working on and trying to submit some grants to study this, validate this in a larger sample of people. And this could possibly be the reason why, one of the reasons why women may not be fusing. As I mentioned earlier, the comorbidity burden in these patients is very high. These 30 to 40% of these patients have a higher risk of cardiovascular disease. And so we also looked at another S100A12 protein in the plasma and found it was elevated in male. And this is the one that activates other MAP kinases and NF-kappa B pathway and could be responsible for atherogenesis in these patients. Incidentally, when I joined University Hospital, I had a meeting with Dr. Dan Simon, and he was wanting to collaborate on a different project with the Division of Rheumatology. And when I was mentioning to him about my research, it was, totally incredibly serendipitous that his lab has done some pioneer work with these S100 proteins. So I am planning to collaborate with his lab to study this further. So I was asked to mention about my overarching career goals. My biggest career goal is I want to really change the clinical paradigm in patients with axial spondyloarthritis. We borrow treatment strategies from clinical trials. And if we look at these clinical trials, they're mostly based on patient population, which is very homogeneous with no comorbidities. We cannot enroll patients with fibromyalgia, depression, anxiety into our clinical trials. So my goal is to perform pragmatic trials that not only provide immunomodulatory therapies to these patients, but also adjunct patients with the goal of providing holistic care and personalized management strategies to these patients. That is what I'm working towards, because when I see my patients in the clinic who, despite taking medications, are still not 100% better, I really want to find ways where I can make them feel 100% better. I'm wanting to look in the lab and working with my collaborators to find what are the pathogenic mechanisms that increase this risk of comorbidities in these patients. When somebody asks me, Marina, what do you like the most? I often tell them I like teaching. So I really want to, provide state-of-the-art teaching to our medical students, residents, fellows, so that they become pioneers in their fields. And that is something I really enjoy, is teaching. So these are a few of my overarching goals. Now, what does this professional appointment mean to me? I feel like that, this appointment has allowed me to develop that confidence that some of these things, these unanswered questions we have, some of the passion I have for this research, this is going to allow me to continue doing that research. It provides me some platform to collaborate with other institutions. I have already established this collaborative consortium called it's called Group for Research and Development in Spondyloarthritis with two of my very close colleagues, Dr. Jesse Walsh from University of Utah and Dr. Alexis Ogday from University of Pennsylvania. I feel like it does serve as a testimonial for my hard work and endorses, some of the respect I have gained in this city. Now, when Dr. Salata informed me that he was going to nominate me for this professorship, believe me, it was very nerve-wracking because I knew Dr. Roland Moskowitz, who was a legend in rheumatology, and I wasn't sure if I was going to be able to live up to his legacy. And, so I'm really thankful to Dr. Moskowitz Foundation, Dr. Salata, Dr. Gerson, and all of you folks from CASE and university colleagues who helped me and nominated me for this professorship. I am hopeful that I will be able to bring back the legacy of Dr. Moskowitz to the division, revive the research, the clinical care we give to our patients, education, despite lacking his humorous wit. I don't think I can ever be able to, get the sense of humor which Dr. Moskowitz had. Ultimately, I want to say it could not have been possible without the unconditional love and support from my family and friends. My husband, who stood by me since age 19, and we first got engaged in the first year of our medical school, my two boys who have been my anchors, my friends from Cleveland Clinic, my friends from Metro Health, Dr. Singer, Dr. Baloo, who have always stood by my side, both during my ups and downs in the last several years, my ladies social club from Cleveland, without whom who are always there by my side to cheer me up, and the women faculty at Case Western Reserve. I feel the women faculty department at Case paved the way for me to be here. they have always been cheerleaders for all the women faculty we have in our division. When somebody asks me, when I interview a potential applicant for our medical school, and they often ask me, what do you like about CASE? And I would say that I love the diversity, I love the camaraderie, and above all, we all try to put our students first. And that's why I love working at CASE. And now my new family, the UH family, which has welcomed me with their open arms since I joined in July. And thank you so much.
It is now my distinct honor to introduce Dr. Douglas Reid. Dr. Reid arrived at Case Western Reserve in 2013 as the chair of the Department of Ophthalmology and Visual Sciences. He is director of the Eye Institute at University Hospitals and division chief of UH Ahuja Medical Center. He is a glaucoma specialist, molecular biologist, and board-certified ophthalmologist. Prior to coming to Cleveland, Dr. Reid was an associate professor at Harvard Medical School, serving as associate chief of operations for the Department of Ophthalmology at Massachusetts Eye and Ear Infirmary. Dr. Reid cares for both adult and pediatric glaucomas. He is often credited for being one of the very few early pioneers that ushered in a new era of surgical management of glaucoma, which has now become largely in a minimally invasive form of surgery. In addition to his main interest for caring for patients, Dr. Reid's scientific research is aimed at determining the cellular and molecular causes of glaucoma while developing disease-modifying treatments as novel therapeutic approaches. Dr. Reid's national leadership is reflected in his service on the National Eye Advisory Council of the National Eye Institute as part of the NIH, the top leadership board to advance the nation's strategic approaches to eye research. He has participated in the training of over 150 residents, 40 clinical fellows, as well as mentored 4 postdoc research fellows, 15 medical, and 9 undergraduate students in his laboratory. It is now my opportunity to present Dr. Reid.
Thank you, Dean Kirsten. It is my distinct pleasure to be introducing a friend and colleague, Dr. Loretta Szczotka-Flynn. As far as disclosures, any talk must have disclosures. Although I do not have any commercial disclosures, I am totally biased. Dr. Szczotka-Flynn has been a wonderful clinical colleague, scientific partner, and role model for many years. Well, let me go over the basics. I have the unenviable task of, in just a few short minutes, trying to summarize 54 pages of professional accomplishment, contribution, and achievement that is chronicled in her CV. Now, just to indicate, when you know someone's going to be really, really educated and smart, when the number of letters of their degree is longer than their name, you know that they're going to be really, really successful. So let's go over some of the basics. Dr. Szczotka-Flynn's story actually begins in Detroit, Michigan. She was born in Detroit to Andrew and Barbara Szczotka. Barbara unfortunately passed away when Loretta was 19. Currently, her parents, Andrew and Anna, are literally returning from Poland today, and we truly hope that they were able to make this call. This is a picture of Loretta when she was a toddler at age 3, and then with her mother at age 8. So then, after weaving her way through the parochial schools, she eventually went to the University of Michigan, where she majored in biology. I'm assured that Dr. Szczotka-Flynn is in this picture, but I can't tell you where. She eventually got her Master's of Science in Physiologic Optics from the Ohio State University College of Optometry and her doctorate in optometric medicine from the Ohio State University College of Optometry. This is a picture of her with some of her graduates at the time. She then, after some years of practice, obtained her doctorate in epidemiology and from Case Western Reserve University. This is a picture with her and Dr. Lass, my predecessor, the chair of ophthalmology, who was very influential in her career, and the two of them have worked very closely together over the years, which you'll hear more about. And at some point along the way, Dr. Szczotka-Flynn got married, and this is a picture with both sides of the family represented at the happy occasion. Now, as far as her academic promotion, in 1992, she started out as an instructor, 94 senior instructor, 96 assistant professor, 2002 associate professor. In 2009, Ohio State inducted her as a clinical professor to the auxiliary faculty. In 2011, she became a professor at Case Western, as well as in the Department of Ophthalmology, as well as epidemiology and biostatistics. And of course, in 2020, although we're celebrating today, she became an endowed professor. This enviable progression, which is punctuated by remarkable achievement, distinguishes her as a role model for any aspiring clinician scientist and any aspiring academician. She's had numerous leadership positions. I've just selected 3 out of a panoply. 1992, she was named the director of the contact lens service. In 2010, she became the director of regulatory affairs for our Vision Research Coordinating Center. And then in 2014, assumed the directorship of the entire Vision Research Coordinating Center. At the national level, she's had several positions. Very early on, she was the vice president of the American Optometric Student Association. She was a national trustee of the AOSA, and she most recently has been leading at the national level, serving as one of the leaders of the East-West annual meeting. Now, out of awards, I had to pick my favorite 3, or the ones that I thought perhaps were most impactful, out of 26, an amazing list of awards. In 2014, she was identified as one of the 100 centennial notables for the Ohio State University College of Optometry. In 2016, at the national level, she was named one of the 30 most influential international contact lens practitioners in the last 30 years. That is a national and international distinction, probably one of the most coveted positions that is hard to obtain, but earned through lots of hard work and achievement. And then in 2017, the Ohio State University College of Optometry recognized her as the Distinguished Alumnus of the Year. She has 103 peer-reviewed publications, publishing in some of our top journals: American Journal of Ophthalmology, JAMA Ophthalmology, Cornea, IOVS, Optometric Visual Sciences, Blue Journal, Molecular Genetics, and the Eye and Contact Lens Journal. There are a number of others, but I just picked off some of our most prestigious. She has 42 book chapters. This is her and Dean Zagnick, who I thought would be attending this virtually as well. I hope that you are. And this is a picture of her receiving that award in 2017. Now, in terms of her major research contributions and grant funding, I had to pick just the major studies because there was a list that was far too long. We're going to hear a little bit more about that during Loretta's talk, but I will tell you that these studies have had global impact. Not only have they answered some of the most important questions in eye disease, but as a result of these studies, they've had global impact to improve the care of patients, not just here in the United States, but worldwide. She has been a site PI for 60 grants, 60 grants. She's had a K23, an R01, an R21, U10, part of a T32. I mean, it almost looks like a list of all the different grants that the National Eye Institute offers. She's had a number of industry and foundation grants as well. Her expertise has been recognized not just by those of us who admire her and get to have the privilege of working with her closely, but she's been invited for 201 national speaking engagements. She's also found time to contribute to the community, not just our academic community, but the community of Northeast Ohio, where she served as a volunteer for the Ohio Optometric Association Real Eyes program, the Ruffing Montessori School Annual Fundraising Committee, Girl Scout Leader Troop 442, the Jesu Wellness Ministry, and she's been the chair of the Figure Skating Committee for the Cleveland Skating Club. Although I'm doing my best to summarize 54 pages of her CV and give you a flavor of what I have been able to observe in my colleague, but I thought it'd be very powerful to hear what patients have said. And this is just direct quotes lifted from our website. I fully trust Dr. Szczotka-Flynn. She knows her craft and listens to everything you have to say. She is empathetic and understands your situation. Dr. Szczotka is the most amazing, caring, knowledgeable doctor out there. And Dr. Szczotka is a wonderful doctor who has been seeing me for over 20 years. We have the privilege of serving our fellow Northeast Ohioans, and I just lifted the first 3 comments off of them. So Loretta, congratulations on your award. Congratulations on being receiving this endowed professorship. And so I want to congratulate you and your entire family. And this is a fairly recent picture of Dr. Szczotka-Flynn with her family, with her husband and 2 daughters. Without further ado, let me turn it over to you, Loretta.
Thank you so much. Thank you, Dr. Reid. That was very, very kind. Okay, thank you so much again, Dr. Reid. That was just outstanding. And thank you so much for your kind comments and for your mentorship as well over the years. And I really also want to thank the Philip and Elizabeth Searle family and Dr. Suber Wang for establishing this very important endowment and professorship at the university, and for Dr. Reid for nominating me, and for the university for selecting me for this unbelievable recognition. It really is protecting me and providing me the opportunity to promote and protect and explore and execute really all the different clinical trials that we have to offer in the Department of Ophthalmology. So I want to go back a little bit and let you know what gave me my spark in research. I was able to cross the border and come from Michigan to Ohio over 30 years ago, and my dad let me come and stay. Fortunately, made some very tremendous relationships and connections at Ohio State. I was invited to join the OP7 program early on. And that is a program where you achieve a dual degree in Doctor of Optometry and a master's in physiological optics. And I was fortunate to actually have 2 different mentors, Barbara Fink and Dr. Hill, who was actually transitioning from research to being the dean at the time. So I was spoiled in having 2 mentors early on. I then kind of fell under the wing of Dr. Barr, who taught me most of what I know today for contact lenses, but Joe also became a very close colleague after graduation, and almost single-handedly pulled me into the CLEC study along with Dr. Zadnik. And actually, Joe's probably responsible for me being in Cleveland because he introduced me to Dr. Lass, who hired me when I was still in February of my senior year of optometry school. And I drove up to Cleveland to interview. My car even broke down on the way. I had to rent a car in Mansfield to get here the rest of the way. But I made it to the interview and was hired, and really have been at the same position for now 30 years. The CLEC study you'll hear about here in a minute, and Dr. Reid mentioned it, that stands for the Collaborative Longitudinal Evaluation of Keratoconus Study. And Carla was the chair of that, but Joe and many other colleagues, including May Gordon, you see here in the picture, and Tim Edrington, were part of this group. And really, it was the first NIH grant that I ever had a chance to be involved in. But it was funded as a planning grant while I was still a student. And I remember seeing the spark in Joe's eyes when he came into class and told us that they received this planning grant. And I knew I wanted to be part of a group that could be NIH funded in the future. And so, lo and behold, I did get to achieve that goal. So I made it up here to Cleveland, and here you can see a picture. I joined the department in July of 1992, And Jonathan Lass, hired me early on, and he put his trust in me very early, even before I was hired. And we've remained very close colleagues. He was a clinical mentor to me and a research mentor, now a research colleague and co-investigator on many grants. I think I'm now the third longest held faculty member left in this picture, after Ed Burney and John Lass. Of course, Bill Reinhardt is retired, and I'm also here next to Dr. Wang, the named professorship here. But Dr. Lass also became a very close colleague of my family's. Here he's playing the cello at our wedding. And I was fortunate enough to be able to celebrate with him when he gained the Castroviejo Award by the Cornea Society recently. So very quickly, my early work is what typical junior early faculty members do. I wrote a bunch of case reports. I played around with some instruments that were new. Corneal topography at the time was a new instrument in our field. And I looked at small groups of patients and learning how to see how contact lenses could be fit better with this new technology. But the CLEC study group trusted me as well as a new grad, allowed me to be a clinical site for them up here in Cleveland and Case Western Reserve University. We were a very high recruiting site, the second highest recruiting site. And we followed 100 patients here in Cleveland for 8 years in this disease of keratoconus, which is where the cornea grows in a conical shape as opposed to growing in a smooth shape. And Carla Zadnik, the chair of the study, and the other planning group allowed me to author at least 5 of their studies amongst probably over 20 publications that they had. But I knew that I wanted more, and I didn't want to always do research for others. I wanted to do my own work, and I wanted to run very large clinical trials of my own. So I learned of a training grant mechanism through the National Eye Institute, a division of the National Institute of Health. And I applied for this training grant, which protected my time to explore a further degree. And so I was able to get a PhD degree in epidemiology and biostatistics. And I had to ask John Lass, would you release me 75% of my clinical efforts so that I could pursue this dream? And he didn't hesitate. He absolutely let me do it. So at this point in time, I was able to study with the then chair of the department, Alf Rim, and Sarah DeBon, who I was able to collaborate with for many years after this. And with 2 kids in tow and my husband who supported me, I was able to study for 6 years and eventually obtain this very important degree, which really, I think, turned my career around. So the PhD degree allowed me to really learn how to execute multi-center clinical trials. And part of my PhD program, I was looking at inflammation in the cornea secondary to contact lens wear. But this then spun off a couple multi-center trials that were sponsored by industry. And together, these 3 trials enrolled over 600 patients, which we followed for at least a year each. And we're able to get multiple publications out of this. But it was my first effort at actually leading a multi-center clinical trial, both statistically and just coordinating it as well as seeing patients. This then kind of spun off into looking at corneal infection, another complication of contact lens wear. And here I was able to get another NIH grant in conjunction with my colleague Sudha Iyengar, who many of you from CASE know very well, a renowned genetic epidemiologist. And Sudha and I are now funded to look at the genetics of contact lens-induced microbial keratitis. And we just received our data and in analysis phase right now, and we look forward to coming out with some really exciting data for you very soon. But then the world of clinical trials really expanded even further. And John brought me in again to coordinate his NIH-funded project. And I have to thank Marianne Redford, who was also my training grant program officer. She is an NIH program officer at the National Eye Institute. And she also kind of spurred our relationship with this study group and brought me closer to this opportunity, being able to collaborate with some of the premier ophthalmic epidemiologists in the world, and that's Roy Beck and the Jabe Center in Tampa, Florida, his colleague Robin Gall, and my partner in crime for this study, Allison Ayala, together with Beth Ann Bennett. We were able to execute this phenomenal 5-year study, which followed over 1,300 patients and over 40 clinical sites around the country to explore a question of donor cornea transplantation to determine whether or not the length of time a cornea is preserved before it's transplanted has an impact on the success of the grant. I was able to really step in and lead a coordinating center that included 40 sites around the country and 27 eye banks and over 1,320 patients. We were able to publish in very high-level journals, JAMA Ophthalmology, for one, where we published our primary outcomes, both in success of the transplant as well as the endothelial cell loss in between the two groups. But we didn't stop there, and this is where this endowment really can help a researcher and a clinician such as myself. We wanted to go further into the question of donor success and transplantation, and we waited 6 years before we could get funded again, which we're currently in the throes of the diabetes endothelial keratoplasty study. But after 6 years and 4 different grant applications and thousands of pages of grant applications, we did receive funding again. But that effort was not compensated. You don't actually realize your protected time and salary support until you're actually funded. So a professorship such as this does allow researchers such as me that protected time to write these grants and explore these questions. And I'm pleased to say that our similar study team, collaboration with the Jabe Center, and now Colleen as our partner, same group here in Cleveland, as well as Mary Ann Price, and some experts in Cleveland in other divisions such as Vincent Monnier and Dr. Arafa. We are now funded to look at the success of donors, whether or not they are diabetic, and their relationship to success in endothelial corneal transplantation. And again, it is a very large multi-center study. This time we have 27 clinical sites and 13 eye banks, and we will be randomizing tissue based on whether or not they came from a donor that had diabetes or not, and following them over 1 year. And we are now just beginning. We have 7 eyes enrolled and about 1,400 left to go. I look forward to that information coming at you over the next 5 years. Because of our successes in coordinating these trials, we've now been able to spin off collaborations and bring work into Case Western Reserve University from other institutions. So I have a collaboration with the Tufts Medical Center on a 1,000-patient trial on dry eye, which I'm coordinating for them, as well as a smaller grant in the optometric world with Marshall B. Ketchum University and Stanford University, looking at a pediatric study of exotropia. And also, because of the successes we've had in clinical trial execution, I was asked by the Department of Population and Quantitative Health Sciences, which is the renamed Epidemiology and Biostatistics Department, to actually teach their clinical trials course. And this has nothing to do with ophthalmology, but I'm teaching the graduate level course now. This is our 4th year in a row in the spring semester, where we have students that are interested in learning about clinical trials across any discipline that they're involved in. And then lastly, I really want to thank Dr. Reid, who you've already heard from, for trusting me from the beginning. As you heard, he made some executive decisions and allowed me to rise to the directorship of the Vision Research Coordinating Center of the department, where I oversee, from an administrative standpoint, all of our clinical trials in the department. We have an excellent team of 5 coordinators, and we've had many others over the years that execute mostly retinal studies, as well as glaucoma and pediatric ones as well. Dr. Reid also trusted me to assist in coordination of a very large clinical trial that we still hope today will someday be funded. It is called the TIME study, the topical versus intracameral moxifloxacin for endophthalmitis prophylaxis study. And this is looking at the injection of antibiotics inside the eye after cataract surgery to prevent a devastating complication called endophthalmitis. I was able to lead actually my first international trial in this area where virtually I collaborated with a group in India to look at whether or not such an injection was traumatic or not to the corneal endothelium. Fortunately, it was not. But we still have a vision today, and under Dr. Reid's leadership, hopefully we can pull a group of entities together, the Asker's Foundation, of course, Case Western Reserve University, the National Eye Institute, and the Department of Veterans Affairs. That's critical to our team. And Dr. Reid has re-energized this study recently with a new corporate partner. So this again shows why we need professorships such as this, because this has already been a 3-year effort, which has not yet secured funding, but it is because of this that we can protect our time and attend meetings and have conference calls in the evenings and on the weekends with the FDA and with our VA partners, and hopefully we'll be able to see this disease treated hopefully better with this treatment option, which is a devastating both retinal as well as intraocular condition that we'd like to prevent. So once again, thank you to the Philip and Elizabeth Searle family and Dr. Wang for putting this professorship in ophthalmology together and for allowing me, again, thank you to Dr. Reid and the university for selecting me for this professorship. How will this professorship enhance my work? Well, again, it does provide the protected time to do all these projects before we can secure funding. It will allow me to continue expert management of the Vision Research Coordinating Center, hopefully expansion of more clinical trials in the department at CWRU, and hopefully expansion of our coordinating center capabilities with infrastructure that we currently do not have. And finally, enhancement and promotion of our clinical trial staff and junior faculty within the department so that they could rise up and lead some trials of their own. I'd like to thank my parents for giving me the opportunities that I have in life, for graduating debt-free, for giving me the work ethic that I currently have, and for my family for putting up with me while I work into the wee hours of the morning sometimes, for putting up with, my lack of being able to cook and clean in the house, and my husband for picking up all that. And, for my girls for keeping it light and lively in the house and making us laugh some of the time. Thank you again very much for this opportunity.
Well, thank you both for your presentations. They were wonderful. It is always remarkable to me that our individuals selected for appointment for endowed professors have such remarkable careers and passion for what they do. So I would like to thank Drs. Magrey and Szczotka-Flynn for more than living up to my expectations. Endowed professorships at academic institutions are elite, as I mentioned, for educators, scientists, doctors, and scholars. These professorships are a mark of honor, one that I hope that you will take with you and sign your name to every day, and respect the prestigious legacy with which you are now endowed, and the donors' efforts to provide support for scholarship in perpetuity as a gesture for the benefits of health to mankind. For Case Western Reserve, these chairs represent our gratitude for Drs. Magrey and Szczotka-Flynn and their leadership and scholarship pursuits in teaching, patient care, and research, and our expectation that you will continue those efforts as valued contributions to medicine, science, and teaching to improve the lives for all of us here in Cleveland. Prior to tonight's events, actual chairs were delivered to both Maria and Loretta. In a normal ceremony, of course, we'd have you sit in them for the first time, and we take a picture of you. It is now my privilege to present Dr. Marina Magrey as the Roland W. Moskowitz, MD, Professor of Rheumatologic Diseases, and Dr. Loretta Szczotka-Flynn as the Philip F. and Elizabeth Searle Wang, MD, Professor of Ophthalmology. Drs. Magrey and Szczotka-Flynn, please take a seat in your chairs. May the rest of us toast their accomplishments. Thank you all for joining. Thank you, Drs. Solata and Ray, for your introductions, and congratulations most to Marina and Loretta and their families. Have a good evening. Thank you.